So my ambitious goal for this next segment is to give you a very brief overview of the key events that have forged the Osher Center and laid the foundation for our latest strategic plan. Given my background in evolutionary biology and traditional Chinese medicine, I'll do this by emphasizing the theme of connections and how through synergies created by a variety of connections, our center has served as a fertile environment for the development of new ideas, programs, and leaders in the field of complementary and integrative health. So, as you all may recall from the birds and bees lecture you were given many years ago, creativity and richness emerge when connections are made under just the right conditions. For example, in flowering plants, the successful merging of pollen and eggs initiates a whole complex life cycle of new organisms and uniqueness. Similarly, in coastal regions such as the Georges Bank in Maine, where the cold, nutrient-rich water upwells along the coast and meets with the warmer waters that are filled with sunshine, there's a lot of phytoplankton blooms that attracts a lot of fish and higher organisms. And so where the bottom and top, the yin and yang, the light and the dark come together, there's creativity, productivity, and great richness. So when things come together, sometimes they're more than the sum of the parts. Similarly, in social networks, including scientific networks, we know that when teams are interdisciplinary and diverse, sometimes they create more productivity and creative research than those that are more homogeneous. And of course, the fundamental premise of integrative medicine is that health emerges when all physiological and biopsychosocial systems are firing together. The cylinders are all in sync and interconnected and supporting each other. So building on this metaphor of connectivity, I'll focus my brief history on just a few prominent figures associated with the Osher Center and how the intellectual and practical connections they forged impacted both the trajectory of our center as well as the broader arc of our field. Obviously, the history of any of these individuals could take multiple seminars, so I apologize in advance for just picking one or two of the connections that I thought were salient. So as you've heard from many people here, and as you all know, our history of our Osher Center, and perhaps much of the history of this discipline, begins with David Eisenberg, who's responsible for many profound connections. But perhaps his most impactful one is the forging of a bridge between conventional and unconventional medicine, which in the 1980s and early 90s just simply did not exist at all. Inspired perhaps by a long personal interest in Eastern medicine, diet, and prevention, he had the genius to design a survey to evaluate the prevalence and pattern of complementary and alternative medicine use in the United States. And what he found literally shocked the medical community. So his first finding was published in 1993 in the very distinguished journal, the New England Journal of Medicine, and had a couple key findings that are worth noting. He found that 1 out of 3 Americans at that time were using what was then called unconventional therapies, and that use led to more visits to unconventional providers than to all primary care providers combined. And it resulted in a great amount of expenditure of dollars, over nearly $14 billion, which is a lot at that time. And importantly, 3/4 of that was being spent out of pocket. It wasn't covered by insurance. Another really important finding was that 3 out of 4 of these users did not discuss their use of integrative medicine with their physicians, which missed the opportunity for synergy in their care and coordinated care, but also opened the door for some potential adverse events, perhaps between the use of supplements and drugs, which may not be, which might have some antagonistic effects. Using his rich and persuasive communication skills, which we all admire, David used these and subsequent data from other surveys to argue that it's conventional medicine's responsibility to evaluate these unconventional therapies for efficacy and safety, and when they're promising, to learn from and integrate them. And the impacts of this work just can't be underestimated. They were published in all mainstream media, newspapers, and magazines. They rippled all the way down to Capitol Hill, where they had a big impact on the formation of NIH's first Office of Alternative Medicine, which then morphed into NCAM and NCCIH. Insurance companies started asking, if people are so interested in this and spending so much money, should we start covering this? And if so, what kind of research is needed to justify that? Similar questions were being asked by hospital CEOs and CFOs. Academic educators were saying, Should we be teaching our students about this in medical school? And David and Ted Kaptchuk and others developed some of the first courses in integrative medicine for medical students. And it led to some of the first big scientific conferences, as Dr. Bitterman said, jointly between UCSF and HMS Osher, bringing this forward to researchers and clinicians around the world. So working closely alongside David, Ted Kaptchuk also played a key role in building the early bridges that shaped the Osher Center. It's never easy to know what's going on in Ted's remarkable mind, for those of you who know Ted. And so in preparation for this meeting, I said, can we take a walk? And I asked him, well, what was it that really attracted you to working with David at the Osher Center? And his first response was, I really wanted a Harvard Medical School library card. And I half believe him, but I think based on his scholarly and clinical training in East Asian medicine, I think a lot of what attracted him was his interest in exploring almost the flip side of David's question. Not so much what can conventional medicine learn by integrating complementary medicine, but what can biomedicine learn from studying unusual practices like acupuncture and integrative medicine? When you bring these two paradigms together, more holistic paradigms and more reductionist, what happens? What do we learn about biomedicine from studying things that are different, almost like studying rare diseases? And we learned a lot. Those of us who work with Ted were just so grateful. Ted will never call himself an acupuncture researcher, but his early research was quite profound, and it led to over 100 publications, which led to significant change in how acupuncture is integrated. And today, I think just about every Harvard-related hospital provides acupuncture in there. But again, I think what was really interesting to Ted was what we learn about biomedicine from studying unusual things. And Helene and I actually wrote a paper with our colleagues from the Society for Acupuncture called Unanticipated Insights into Biomedicine. What do we learn about biomedicine from studying acupuncture? And a couple things emerged. We know that early research in acupuncture pointed to these endogenous opioids and as a mechanism for pain, but studying that in neural networks really accelerated the rate of what we learned about the neurophysiological basis of pain. And there's some really key research in acupuncture that stimulated that. Similarly, and I'll share something on the next slide about Helene's work, needling and its connection to connective tissue started a whole field of research. And it may have moved forward, but the work that Helene started and continues to do really catalyzed this whole new discipline of understanding the role of connective tissue, fascia, and health. Studying acupuncture is really different than studying pills. These complex non-pharmacological interventions require really different designs. So some of this work catalyzed a whole movement in understanding new ways to design pragmatic clinical trials. But I think for Ted, the biggest interest was in these therapeutic encounters, what's the role of belief, expectation, context, and ritual, what we might call placebo effect. And those of you who know about Ted's work know that he's now one of the world authorities, if not the, in placebo research. And this work, starting at the Osher Center, birthed his program in placebo studies in the therapeutic encounter. It's called the PIPS program. And there's not time here to unpack that, but it's a remarkable portfolio of work that Ted's done. In 2015, the New Yorker said of Ted's work and the work at PIPS that it's some of the most notable medical findings. And that was even before he had the chutzpah of doing the first open-label placebo study. So quite remarkable work that was spawned here by these questions of building connections early on at the Osher Center. So as you heard, once we launched the Osher program, it was clear that we needed a clinic, a kind of a test kitchen or a laboratory of sorts where we can evaluate and deliver integrative medicine in our community. And Don Levy was recruited as the medical director in 2006 and couldn't have been a better choice. Don and the team he and David and others built were centered around multiple ideas of connection. First, as a clinician, Don has a remarkable gift of listening to and connecting to his patient. And I know this firsthand because coincidentally, this is completely coincidental, before both Don and I were recruited, Don was my primary care physician. And we wound up at the Osher Center one day and we were looking at each other, what are you doing? What are you doing here? And he says, I'm sorry, you're not gonna be my patient anymore. But as you'll hear soon from Don himself, his philosophy focuses more on healing the whole person than just curing the symptoms. While he knows how to diagnose what's the matter with this patient, he also deeply cares about what matters to them. Not surprising, he's won the Best Doctor and Integrative Medicine Award pretty much every year since he's been at the Osher Center. Second, Don deeply cares about his clinical team, the connections there, and leads in a non-hierarchical way, treating the massage therapists and the administrative staff with as much respect as the neurologists. He's built and sustained a team that all share his love and passion for healing, and it's not a surprise that nearly 15 years later, about 50% of the team is still intact. And finally, I think Don and David were felt strongly about not creating a standalone clinic out in the secular community, but really integrating this and connecting it to the hospital system, and Brigham Women's Hospital in particular. And so we situated the program in the ambulatory center. It shared medical records. It created opportunities for co-location and referrals. And that was a really important piece, as Dr. Anderson said, that has led to us thriving today. So Helene Langevin is another remarkable connector and integrator and dear friend. Her early training likely influenced this and didn't stop with internal medicine, but also included fellowships in basic endocrinology and neurobiology, followed by formal training in acupuncture. She went to school, get a degree. This rich mixture led her to her early elegant studies on the links between acupuncture needling and connective tissue. But I think more broadly, and I think as David and Paul have alluded to this, this work modeled that rigorous science could be applied to integrative medicine. And I'll just go off my notes here, but I remember when we recruited Helene for her job talk, and I believe Barbara was in the audience, David, Paul, many others. Their mouths were slightly open at the basic research she was doing. It was like, she does real research. And not that anyone doubted that initially, but I think they were just so impressed that you can take the most rigorous basic work and apply it. And Helene has often used this diagram on the left of the iceberg to emphasize that it may be alternative therapies and conventional therapies on top, but underneath it, there's the same pathology and pathophysiology and physiological processes. And we can use those same rigorous tools to interrogate this and learn from them. So I think that's one of the great connections that she's made. I think her studies of how the structure and function of fascia interfaces and links with the musculoskeletal system, with the nervous system, the immune system, and along with my own work, linking cognitive and motor processes in Tai Chi, led our teams here at Osher to question the limits of siloed organ-based medicine and the need to also think about interactions between systems and whole person health. And as we've heard, in 2018, Helene was sworn in at NCCIH, where she and her team have further developed a truly inspired strategic plan. And if you haven't had a chance to read it, I really encourage you to, around whole person health that continues to appreciate not only the value of analysis and basic research and reductionism and breaking things down into smaller and smaller parts, but equally appreciates putting Humpty Dumpty back together again and studying whole person health and synergy. So this model of whole person health continues to guide much of the work that we're doing here at our Osher Center today in our new strategic plan. So the final person I want to highlight here is David Golan. And during the transition leading up to the recruitment of Helene as a second director, David had the vision of transforming the Osher program away from being a siloed standalone program to more of a virtual center, what we started to call a center without walls. And in addition to practical and administrative reasons, there was a significant motivation for this restructuring, was that it would better position us to be stewards to the integrative medicine community across Harvard. And as it turned out, when Helene and I started to build this model out, we learned that there were actually 15 integrative medicine clinics and programs across the Harvard landscape, and most of them were not collaborating with each other, and many were completely unaware of the existence of the others. This transition also coincided with a research inventory and audit I was doing, and when we collected the data, we'd found that 670 people at this time, researchers at Harvard, had published a paper on integrative medicine. And I remember the conversation with Helene in our office, and we were sitting there looking, what are we going to do with this? What kind of paper do we want to write? And Helene said, let's map it out. Let's create a network map. And I thought, okay. And it became really interesting. If we create this map and put everyone on it, what will happen to our community when it becomes aware of itself? And it was just, it's like almost a Zen koan, but it's been one of our sort of phrases that we've been going to regularly. So In that spirit, in 2014, we created our first network forum, and we invited all these participants together as well as other people, and it was a great success. We had 325 people from institutes, and probably the first time that all these people were together in one photo and in one place, and it was really rich. Darshan's going to talk much more as our education director about the network forum. We do one every 2 years on a different theme, and it's really one of the flagship programs. Another flagship program that Helene conceived of was the Integrative Medicine Grand Rounds. If you listen to her interview with Atra, I think she highlights this as one of her favorite accomplishments at Osher. But we were all like, no, people are not going to want to come to this auditorium at 8 in the morning for grand rounds on integrative medicine, and we were really wrong. And so Darshan's also going to say some more about that, but it's really been a great productive program. One of the programs I'm most proud of that brings our community together is our pilot research grant program. To date, we've given away over $1.1 million, 35 new projects, and by definition, to apply for this grant, you have to build a new connection. You have to go past the boundaries of your department and institution and work with someone new. And I think this picture tells 1,000 words. This is our network. If we go back to the publications in 2000, this is 20 years later, essentially 2019, and who knows what it's going to look like in a couple years. And it's not that we've done this ourselves as the Osher Center, but we're holding the space for people to become aware of it, and we're catalyzing a lot of these connections, and we're really proud of that. So all this history brings us up to the present and now our new strategic plan, which you'll hear about from our various program leaders. The plan was developed iteratively over just a period of a year. And in addition to our input, we solicited important input from our scientific advisory committee that Julie Buring leads, our oversight committee leaders at other Osher centers and other leaders in the field. The document is meant to be a living document and adaptable to opportunities and challenges that we meet as time unfolds. But before looking forward and hearing about our new plan, we're first going to hear from Drs. Levy and Dr. Levy and Dr. Julie Buring about their philosophies of medicine and research, respectively, that shaped the early formation of our center. So it's now my distinct pleasure to introduce my dear friend and colleague and the director of our clinic, Don Levy.